The term angioplasty, angio means blood vessel, and plasty is opening up. An angioplasty is a surgical procedure to open the blood vessels that supply blood to your heart muscle. These blood vessels are known as coronary arteries. Angioplasty is a conventional treatment for coronary artery disease and heart attacks. In these conditions, there is a buildup of plaque, or atherosclerosis, on the walls of the arteries. As plaque accumulates, the arteries narrow and can become blocked. In a heart attack, the plaque may rupture, leading to a clot that stops blood flow. Doctors perform more than 1.8 million angioplasties a year in the United States, according to the American College of Cardiology. Let us see how angioplasty is performed. Before beginning angioplasty, a healthcare professional will clean the artery, which helps identify blockages around the heart. This process is numb the area where the catheter enters the body, usually the groin but sometimes the wrist. Next, a doctor inserts the catheter into the artery and directs it towards the coronary artery, watching its progress on an X-ray feed. Once the catheter is in position, the doctor injects a contrast dye through. When the second catheter is in position, the doctor inflates the balloon by called angiography. Once they locate the blockages, the doctor inserts a second catheter and a guide wire, usually with a balloon at the tip. When the second catheter is in position, the doctor inflates the balloon by which the fatty deposits, or plaque, get pushed against the wall of the catheter. Is guided through the artery to the blockage. At the blockage, the balloon is inflated and the spring-like stent called a stent. Most people who have an angioplasty also have a stent placed in their blocked artery during the same procedure. A stent, which looks like a tiny coil of wire mesh, supports the walls of your artery and helps prevent it from re-narrowing after the angioplasty. What happens during a stent placement? Expands and locks into. Place inside the artery. The stent stays in the artery permanently to hold it open and improve blood flow to your heart. In some cases, more than one stent may be needed to open a blockage. Once the stent is in place, the balloon catheter is deflated and removed. More X-ray images are taken to see how well blood flows through your newly widened artery. Most stents implanted during an angioplasty are drug-coated. The medication in the stent is slowly released to help prevent future plaque buildup and the re-narrowing of the blood vessel. Recovery. When angioplasty is completed, the cardiologist removes the catheters and bandages.